What is a suppository? A. A type of tablet. B. A dosage form inserted into a body orifice. C. A type of injection. D. A liquid medication. The correct answer is B. A suppository is a solid dosage form intended for insertion into body orifices where they melt or dissolve to exert systemic or local effects. Which of the following is not a type of suppository base? A. Glycerinated gelatin. B. Cocoa butter. C. Acacia. D. Polyethylene glycol. The correct answer is C. Acacia is not a common suppository base. The others are commonly used bases. Which type of suppository base is water-soluble and good for drug release but may cause irritation? A. Cocoa butter. B. Polyethylene glycol. C. Glycerinated gelatin. D. Acacia. The correct answer is B. Polyethylene glycol is a water-soluble base that is good for drug release but may cause irritation to sensitive tissues. How are suppositories typically prepared? A. By grinding the active ingredient into a fine powder. B. By mixing the drug with a liquid solvent. C. By melting the base and incorporating the drug. D. By compressing the ingredients into a solid tablet. The correct answer is C. Suppositories are typically prepared by melting the base and incorporating the drug into the molten mixture. What is a common evaluation technique for suppositories to assess drug release rates? A. TLC analysis. B. High-performance liquid chromatography, HPLC. C. Dissolution testing. D. X-ray diffraction. The correct answer is C. Dissolution testing is commonly used to assess the release rates of drugs from suppositories. What is the purpose of adding a lubricant to suppositories during preparation? A. To enhance drug release. B. To improve shelf life. C. To prevent adhesion to the mold. D. To increase the melting point. The correct answer is C. Adding a lubricant helps prevent adhesion of the suppository mixture to the mold during preparation. Which of the following is not a common route of administration for suppositories? A. Oral. B. Rectal. C. Vaginal. D. Nasal. The correct answer is A. Suppositories are not typically administered orally. What is an example of a drug commonly formulated as a suppository for rectal administration? A. Aspirin. B. Insulin. C. Estradiol. D. Epinephrine. The correct answer is C. Estradiol is an example of a drug commonly formulated as a rectal suppository for systemic absorption. Which type of suppositories are prepared by using a molding apparatus to shape the suppository mass? A. Fusion suppositories. B. Compression suppositories. C. Molded suppositories. D. Solution suppositories. The correct answer is C. Molded suppositories are prepared using a molding apparatus to shape the suppository mass into the desired form. What method of suppository preparation involves mixing the drug with the melted base and pouring the mixture into a suitable mold? A. Fusion method. B. Compression method. C. Molding method. D. Solution method. The correct answer is A. The fusion method involves mixing the drug with the melted base and pouring the mixture into a suitable mold for suppository preparation. Which of the following is not a common type of suppository base? A. Cocoa butter. B. Glycerinated gelatin. C. Silica gel. D. PEG. The correct answer is C. Silica gel is not a common type of suppository base used in pharmaceutical formulations. Which evaluation technique can be used to assess the physical appearance and uniformity of suppositories? A. High-performance liquid chromatography, HPLC. B. Dissolution testing. C. Disintegration testing. D. Visual inspection. The correct answer is D. Visual inspection is an evaluation technique used to assess the physical appearance and uniformity of suppositories. Which method of suppository preparation involves compressing powdered ingredients into a solid mass using pressure or force? A. Fusion method. B. Compression method. C. Molding method. D. Solution method. The correct answer is B. The compression method involves compressing powdered ingredients into a solid mass using pressure or force for suppository preparation. Which of the following types of suppositories are designed to melt or dissolve at body temperature within the rectum or vagina? A. Rectal suppositories. B. Vaginal suppositories. C. Urethral suppositories. D. Nasal suppositories. The correct answer is A. Rectal suppositories are designed to melt or dissolve at body temperature within the rectum for drug absorption. What is an advantage of using fatty-based suppositories for drug delivery? A. Enhanced drug solubility. B. Minimized drug absorption. C. Prolonged drug release. D. Reduced patient comfort. The correct answer is C. Fatty bases can provide a prolonged drug release, making them advantageous for certain drugs. What is the purpose of incorporating preservatives into suppositories during preparation? A. Enhance drug release. B. Improve patient compliance. C. Prolong shelf life. D. Increase suppository hardness. The correct answer is C. Preservatives are added to suppositories to prolong their shelf life by preventing microbial contamination. What evaluation technique is commonly used to assess the disintegration time of suppositories in various media? A. Dissolution testing. B. Disintegration testing. C. Hardness testing. D. Uniformity testing. The correct answer is B. Disintegration testing is performed to assess the disintegration time of suppositories in different media, which is important for drug release. What is the primary purpose of using antioxidants in suppository preparations? A. Enhance drug release. B. Reduce microbial contamination. C. Prevent drug degradation. D. Improve patient comfort. The correct answer is C. Antioxidants are added to suppositories to prevent drug degradation caused by oxidation. Which evaluation technique is used to assess the pH of suppositories in order to ensure compatibility with the mucosal tissues? A. pH testing. B. Microbial testing. C. Moisture content testing. D. Viscosity testing. The correct answer is A. pH testing is crucial to ensure that suppositories are compatible with mucosal tissues and do not cause irritation. What is the process of shaping the suppository mass into a specific form known as? A. Molding. B. Compression. C. Dissolution. D. Solution. The correct answer is A. Molding is the process of shaping the suppository mass into a specific form before solidification. Which evaluation technique is commonly used to assess the disintegration time of suppositories in various media? A. Friability testing. B. Dissolution testing. C. Disintegration testing. D. Hardness testing. The correct answer is C. Disintegration testing is commonly used to assess the disintegration time of suppositories in different media. What is the purpose of incorporating preservatives into suppositories during preparation? A. To enhance drug release. B. To improve stability. C. To prolong shelf life. D. To increase viscosity. The correct answer is C. Preservatives are added to suppositories to prolong shelf life by preventing microbial growth. Which type of suppository base allows for rapid drug release due to its water-miscible nature? A. Cocoa butter. B. Glycerinated gelatin. C. Polyethylene glycol. D. Hydrogenated fats. The correct answer is C. Polyethylene glycol is water miscible and allows for rapid drug release from suppositories. What evaluation technique is commonly used to assess the physical appearance and uniformity of suppositories? A. Dissolution testing. B. Friability testing. C. Appearance testing. D. Hardness testing. The correct answer is C. Appearance testing is commonly used to assess the physical appearance and uniformity of suppositories. Which type of suppository base is water-soluble and can be used for drugs that require immediate release? A. Cocoa butter. B. Polyethylene glycol. C. Vitepsol. D. Hydrogenated fats. The correct answer is B. Polyethylene glycol is water-soluble and suitable for drugs that require immediate release. What method of suppository preparation involves mixing the drug with the melted base and pouring the mixture into a suitable mold? A. Compression. B. Dissolution. C. Incorporation. D. Fusion. The correct answer is D. Fusion method involves mixing the drug with the melted base before pouring it into a mold for solidification. Which type of suppository base can be used for drugs that are soluble in water but not in oil? A. Cocoa butter. B. Polyethylene glycol. C. Vitepsol. D. Hydrogenated fats. The correct answer is B. Polyethylene glycol can be used for drugs soluble in water but not in oil. What is the purpose of incorporating a lubricant into suppositories during preparation? A. To enhance drug release. B. To improve patient comfort during administration. C. To increase the hardness of suppositories. D. To prevent oxidation of drug ingredients. The correct answer is B. Lubricants are added to facilitate easier removal of suppositories from molds and improve patient comfort during administration. In suppository preparation, which method involves compressing powdered ingredients into a solid mass using pressure or force? A. Fusion method. B. Compression method. C. Molding method. D. Dissolution method. The correct answer is B. The compression method involves compressing powdered ingredients into a solid mass using pressure or force. What is the primary purpose of using antioxidants in suppository preparations? A. To enhance drug release. B. To improve patient compliance. C. To prevent degradation of drug ingredients. D. To increase the hardness of suppositories. The correct answer is C. Antioxidants are used to prevent degradation of drug ingredients in suppository formulations. Which evaluation technique is used to assess the pH of suppositories in order to ensure compatibility with the mucosal tissues? A. pH meter analysis. B. High-performance liquid chromatography, HPLC. C. Potentiometric titration. D. Ultraviolet visible, UV spectroscopy. The correct answer is A. pH meter analysis is used to assess the pH of suppositories for compatibility with mucosal tissues. What is the process of shaping the suppository mass into a specific form known as? A. Molding. B. Fusion. C. Compression. D. Extrusion. The correct answer is A. Molding is the process of shaping the suppository mass into a specific form. What is the purpose of using a suppository base in the preparation of suppositories? A. To provide a structure for the suppository mass. B. To enhance drug taste. C. To increase drug stability. D. To reduce drug solubility. The correct answer is A. The suppository base is used to provide a structure for the suppository mass, helping to shape and hold the active drug ingredient.